and CEO Money. I'm Michael Yorba. Thanks for joining with us. All right, I have Amber Billman. She is the CEO of Health Receivable Resources. Amber, welcome to the show.
Thank you for having me.
I'm glad you're here. All right, give us some background about you and what Receivable Resources does. Then I want to walk in through a couple of questions for you.
All right. I have been with the company for 4 years. I was just recently brought in as CEO, voted in by the board about 4 months ago.
Congratulations.
Thank you. And basically, our company, we are a partner for healthcare, hospitals, physicians, practices to help them achieve bringing in the most money, whether it be through insurance, patients, and just increasing the revenue.
Okay. Part of that is communication, I understand.
Absolutely.
And that is a multi-tiered process. Give me how you're molding the company and driving it forward with, at least we'll start with the communication process. There's more to it than that, but let's start with the communication process. What is your message to the clients that you work with and the people inside of your organization that you work with in regards to communications?
Communication is the key to any successful business. And I know that sounds like a cliche, but it's true.
No, it is.
The one thing that I tell my staff is we need to know our clients. We need to know them personally, we need to know them professionally, and we need to know what they need and want before they need and want it.
That's good.
And that's part of good client communication. And with that, I feel like that most of our clients we have great relationships with. There's a few new clients for me in this position that I haven't gotten really acclimated with, but I'm getting there. And
you just moved up to
exactly,
of course.
exactly. But the clients that I've had for years, I feel like I know them all very personally, and it's a partnership.
Now, in communication, there's also education about new and better ways to do that. There's multi-tiered processes for educating the clients and the staff. Are you doing anything in that process?
Absolutely. One thing that we pride ourselves on for our clients is we help find root cause issues of why they are not collecting the money or from either the insurance company or the patient, and what is slowing that process down. And we've actually implemented something new this year in 2019. We have been going and traveling to our clients' facilities and helping train their staff on registration processing, insurance verification, which is the key importance to the bottom dollar.
It is. Now, you wouldn't be in business unless you were performing. So when you go in and engage with, say, a new client that's unfamiliar with your processes, your educational processes, the communication, and so on, is there some kind of a benchmark that you look to try and achieve in order to create a higher revenue stream by implementing your communication and your processes and your people?
Absolutely. When we go in, the first thing to find out is what's going on in their facility,
right.
What's going on in their office. What are the first things that we can help them with to change and to create a better revenue stream. And with that being said, we do have success stories that we can give them. A lot of our clients are in the rural element, and so a lot of them know each other. And so whenever we go to another rural client, we can say, hey, we are working with, another facility down the road, and they have seen their success.
You got to be a family member in that environment. You can't just be an urban number puncher.
Oh, absolutely not. You have to be a family member.
So you invite them into your family.
Absolutely.
Okay, I get it.
Absolutely. We invite them into our family, and they invite us into their family.
Let me jump. We only have so much time, and I got a lot I'm going to cover with you. Being able to turn bad debt into good business. That's kind of a mantra with your company. Talk to me about how that happens.
Well, I think one key part of our business is bad debt collections, delinquent debt collections.
Right.
And delinquent debt collecting has a very negative stigma in the world. And the one thing that we pride ourselves on is relationship with the patient, compassion and understanding for the patient, and collections with customer service. It's not about beating them over the head. Sometimes it's about listening and understanding their situation and then helping work them through that situation. And that's the best way to collect money for our client and to help the patient.
That's a good way to look at it. I really appreciate you saying it that way. The things that I wanted everybody else to get from you too is there's big challenges facing healthcare right now.
There are.
You know what they are. You talk to all of the healthcare providers and the people that receive the healthcare. Tell our audience, that's our audience right there, tell our audience how these changes are affecting both sides of the equation.
Well, I think the biggest challenge right now is insurance, number one, with high deductible plans. There's so many patients that they have large premiums monthly to cover their family and the insurance for their family. And with that, then they have a $10,000 deductible they have to meet. And I would say that 90% of healthcare is not pre-planned. You don't plan to have a heart attack. You don't plan to break a leg. And so when things like that happen and it's a catastrophe for your finances and your family, it's that realization that I don't have the finances to cover this. And I think that's one big, huge problem in healthcare today. It's a cyclical issue because it not only affects the facility, it affects the physician, it affects the patient, and it's just an ongoing process.
Now, there are advantages of having a single full-service revenue management partner. Give us those advantages.
Well, it makes for a seamless operation. For our clients where we handle their insurance billing, their early out or soft collections, and then their delinquent debt, it's an internal process for us where we move those accounts along. And it's something that the client, they don't have to worry about it. It's kind of like the set it and forget it method. They place the accounts with us, and then we do all the work from there. We send them monthly reports and a check. So it works out well for them.
How does HRS really, do the insurer providers get the maximum reimbursement in their medical billing? That's an interesting, that's got to be the secret sauce.
It is, and it goes back to the training and the relationship. Sometimes they may not be getting the maximum reimbursement because there's a problem on the front end with registration, insurance verification, things like that. And a lot of times just that training, it increases their revenue significantly just from small changes. And so that's huge. The other thing is anytime we see that we can appeal a claim or we feel like that it's not paid, we have contracts for all of our clients, their insurance contracts. And so we review those to make sure that they're getting maximum reimbursement as well.
Now, when you say a significant change in the revenue stream, and anybody that has to deal with the money, because I know every time I speak to doctors or healthcare practitioners, then I don't do the money. I just heal you.
You're right.
But when you say a significant change, what do you mean by that?
A significant change.
20% increase in revenue stream?
Absolutely. Absolutely.
What's our good number for that?
A good number would probably be 30 to 40%.
That's big.
That's huge.
That's millions and millions of dollars
Yes.
when you're talking about big size.
Absolutely. Absolutely. And the other thing is it comes back to that customer service. When you have customer service with the patient and you have that empathy for them, you can get them to pay their bill. And that also increases the revenue stream for that facility or that doctor.
Got it. Well said. All right. Thank you for being a guest on today's show.
All right. Thank you for having me.
My pleasure. You've been watching CEO Money with Michael Yorba. Like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.